Coming to the next set of questions, many patients did have questions related to medications versus flare. So, what are the common drugs which are used for a patient with lupus, and what are the common side effects due to the drugs that a patient would face on a regular basis?
So lupus, unfortunately, most of the patients would require medications. The commonly used medications are hydroxychloroquine, which is originally an anti-malarial, but when they were using these drugs for malaria prophylaxis in tropical countries, and smart clinicians have observed that many of the patients' skin lesions improve, joint pains improve. So that is how it became an anti-rheumatic drug. It is also used in rheumatoid arthritis, and it is one of the main drugs used in all patients with systemic lupus erythematosus or SLE. The next important drug which is used is a most dreaded drug in the pharmacopoeia is steroid. So steroid is always mirrored by myths and fear. But steroid is a friend for patients who have lupus.
Rheumatologist.
Sorry. Okay. And steroid is a friend, and steroid is used nowadays very, very diligently, and it is given for the shortest period of time. And most of the international guidelines are the bodies which tell the doctors how to treat the patients, how to give them the general guidelines, generally recognize the importance of steroid and also recognize these potential hazards of steroid. So it is important to give steroid as little as possible and as short time as possible so that they get the benefit of the disease, but they don't suffer from the side effects of the steroids. Apart from that, other group of drugs which we use are immunomodulators. Immunomodulators are drugs which act like steroids but don't have the side effects of steroids. So we use it to reduce the amount of steroid we use. So we use a drug which can control the kidney disease or a brain disease or a skin disease so that I can use less and less steroids. And the last category of drugs are called biologicals. Biologicals are drugs which are produced by biological means, and they are not tablets. Generally, they act against a cell in the body, like a B cell, and are cytokine. Cytokine is a chemical produced by the immune system. So we can block the cytokine and thereby reduce the symptoms. So most of the immune system manifestations are driven by immune cells and also the chemicals secreted by the immune cells. So if you target either the cell or the chemicals produced by the cells, we can control the disease activity and we can prevent damage. Side effects I've already alluded to. The commonest side effect with hydroxychloroquine is a little bit of skin darkening. So this is the most important cause. It can of major concern in younger people who definitely value their appearance, and suddenly change in appearance can be very devastating. Apart from that, some people get rashes, and if it has to be used for more than 5 years, and it can cause pigmentation in the inner eye layer, and which needs to be monitored. If it is not monitored, it can cause visual disturbance. Steroid side effect is very well known. People do gain weight, and if you have a tendency to develop diabetes, hypertension, it can promote it, and it can also weaken the bones, and it can also cause something called avascular necrosis of the bones. And not everybody gets it. A small percentage of patients do get it, but the most common dreaded side effect is weight gain, and also hirsutism, where people grow hair where they don't want to. So if a young woman develops facial hair, this could be very distressing. And change in the body image. If somebody puts on weight where they don't want to have a fat, it can be a major problem. That is the reason it is used as short term as possible nowadays. And side effects of the other immunomodulators are generally related to immunosuppression. And we need to be watchful about low WBC counts. Sometimes some of them affect the liver. So we need to monitor. Most of the patients who take these drugs tolerate it very well. About 5 to 10% of the people can develop side effects. It is the doctor's duty to monitor it. And if they have any side effects, they will change the drug or do appropriate reduction of the dose so that the patient can get the benefit without getting the side effects.
Thank you, doctor. That was an elaborate and informative answer to your question. Going on to the next question, which kind of overlaps with this. So, there are side effects, and then there is also symptoms that we notice in a flare. For example, one of the common side effects that is encountered is gastritis. It could also be seen in a flare-up as gastric inflammation. So, how do the patients differentiate it from a side effect or flare, or what are the danger signs which could indicate that it is a flare rather than a side effect? So, how do we go about this tricky situation?
Yeah. So it can be difficult both for patients to recognize whether they have a problem because of the drug or is the disease playing up. But there are some clues, like if usually drug-related side effects are like one skin rashes, and it is related to drug usage in time. Like if you started it on the first of this month, if you develop a rash within a week, then we can relate it to the drug. Or you are on the drug, but you have gone to the beach and to develop a severe sensitivity, then probably it is more likely to be disease related. And also, if there are other disease related symptoms in the patient, and when the patient have like a headache, they also have a rash, they also have mouth ulcers, they have a significant hair fall, then that is likely to be due to the disease. It is difficult. We have to keep looking for a clues, and the sometimes the clues can be veiled and not easily visible. So it is the duty of our doctors to keep looking for a clue to differentiate whether the problem is due to the disease or due to the drug, because the treatment can be totally different.
Yes, doctor. Understood. So it is, in summary, it is something like it's not an isolated thing that we need to look into. If it is pointing more towards a disease, there will be other signs of the flare also, just apart from the drug and the temporal relationship with the drug starting and the side effects. Got it. All right. Coming on to a very commonly asked question, and also I have been a culprit of this too. If I miss a dose, or if I happen to miss a dose, how do we go about the next dose? Or is it okay if I miss a dose? Some patients start panicking, oh no, I didn't take my medicines, my disease will turn up. So, in such a situation, how do we go about missing doses and further medication?
So this is an important question because drugs work only if you take it, and compliance is very, very important for the disease to get controlled. But having said that, we are all human beings. If somebody says that, doctor, in my 15 years, I've never missed a single dose, then I have a doubt whether this is a person in front of me or is it a robo, right? We are all human beings. We are all frail human beings. We are entitled to miss once in a while. So if you miss a morning dose, you have forgotten to take the morning, it is okay to take it in the afternoon. Though the doctor has asked you to take it in the morning, you can take it in the afternoon. If you have totally forgotten today, it's okay. Next day onwards, you can be more compliant. Never double the dose, because double the dose can be problematic. And that's all I think. You don't worry too much about if you miss a single dose, but make sure that you don't miss it on a long-term basis. Have a system to remind you. Nowadays mobiles are very handy. You can always have a reminder in your mobiles, and there is always somebody at home, mom, or a spouse, or a friend. You can use them to once in a while to remind you whether are you regular with the medications. That would help. That would help.
Yes,
But
doctor.
the no
Definitely.
sleep over one single missed dose, that's okay.
Yes, doctor. I mean, I remember shifting into a box which had the days days organizer, timing organizer, and putting the pills into that. So I'm double sure that I've taken the medication at the
Yeah,
right
but one day you may forget to take the, when you are going out, you may forget to take the box itself. So these are all the kind of things happen. So always carry a prescription with you. So suddenly you realize that you are ended up in Bombay. You forgot to bring your medicine. You can always buy the medicines in a medical shop in Mumbai and take the medications. But if you are going to stay in Mumbai for more than few days, right? You are going to come back in the night, it's okay. But if you are going to stay, you can always carry a prescription, either a physical copy or a photocopy with you, so that you can buy the drugs.
Definitely, doctor. So I think you've also addressed the fact briefly about how it is tough to maintain compliance. Many of our patients also face habit fatigue. And I have seen so many of my loopy friends also who have been confident that they are in remission and they don't need the drugs anymore because they're tired of taking the drugs. The monetary benefits, I mean, the money is difficult to arrange for, and they just give it up. So, how do we deal with one, low motivation, and two, the habit fatigue that comes with a routine, especially in drugs, with respect to drugs?
This habit fatigue can be very real, particularly when you are doing well. When you are still having a joint pains or if you have a rash, the rashes and joint pains will remind you to take the medications. When you are doing well, you are on maintenance mode. So you would look normal, you will feel normal, and then you can forget. So it is a real problem. So we need to overcome by educating ourselves to the need. So what will happen if I stop? If I stop, if the disease comes back, it can become nastier than what it was, and you may require more medications. So this knowledge will prompt us to be little more regular and beat the fatigue. And also we can keep some, as I told you, you can keep some reminders so that you are reminded to take the medicines, and also involve your caregiver like parents, spouse, friends. So they also will reinforce that the need to take medication. So always involve them in your care, whoever you have a trust, and this is important for them to be a part of your journey so that they can help you. It's difficult. It's difficult. Once in a while we'll flip, we'll learn, and then again next time you will be a little more strict. And whenever you go to the doctors, doctors also ask whether you are taking the medicines. Many times we are scared of doctors, and we tell that, okay, okay, doctor, we are taking. So we have had patients who were not taking medicine, not because of habit forming, but due to various reasons. People are scared of steroids. People are scared of getting obese with steroids. And people, obviously, they buy the drug and hide it somewhere, and parents don't know. When they come to us, they are not doing well. So we have to break our head every time, give a new drug, but only to find that they've not been taking the medicine for the last 6 months. So it can be a problem, particularly in a youngster who are generally, like, the rebellious character is inbuilt in adolescence. All of us were rebellious. We didn't want to listen to everybody, and we don't want to follow the norm. People hate going to the hospital. So in that scenario, it is easy to drift into non-compliance, and the education and involvement of the society and friends is very important.
Thank you very much, Doctor. Coming on to the last question in this section. As we know that many of us do travel often in terms of work or just a normal travel to workplace, morning to evening, this something that I do practice and carry is my emergency medicine kit. Some sort of medications that I need to keep with myself at all given times. So, if you were to suggest what should be the medications, basic ones to keep with yourself as a patient in terms of a regular routine travel or long-term travel, that would be good because this was also one of the questions that is commonly asked.
And then people should carry their prescribed medication. That is the most important thing. So if they have their prescribed medications, most of the time things are taken care. And one important thing I would recommend everybody to carry is, particularly when you are going for a trip or a travel or you might go out in sun. Don't forget to carry a sunscreen and carry maybe a hat or pack some long sleeved dress. So the sunscreen is a very important protective tool, because the sun induced damage is like a booster for the immune system to attack ourselves, because the sun in a sensitive individual causes sunburn or a sun damage. The damaged cells leach out their DNAs and other materials, and they get exposed to the immune system, and they produce more and more immune complexes and can cause a flare to the disease. It's so a severe sun exposure and exposure induced damage can act as a booster for the disease. So we have to be very careful. Apart from that, like a commonly used drug, some paracetamol is always a safe pain medicines. And what else? And carry a steroid, even if you have come out of steroid, maybe a pack of steroid, maybe 10, 15 tablets of steroid, like a prednisolone or methylprednisolone, 1 or 2 sheets. Suddenly you get a joint pain, you can manage it with one or two tablets of prednisolone until you come back and reach your doctors. So steroid pack could be useful. I won't advise you to carry antibiotics and other stuff, because most of the infections we get is viral and they don't require antibiotics. So unnecessarily we start taking antibiotics and damage our gut bacteria, which can have actually a negative impact on the immune system and probably lupus. Another simple drug which you should carry is an antihistamine, like Avil or allergy tablets. Sometimes we get itching or rashes. You not go to a doctor, you can take on Allegra or Avil and manage. So these are the things we should carry apart from your prescribed drugs. They are the most important drugs.
Yes, doctor, definitely. Thank you so much for that answering that question. So, in summary, with respect to medication versus flare, we need to make sure that we watch out the side effects versus the lupus flare symptoms as such, and we should always keep an emergency kit with us. And compliance is very important, and be truthful to your consultant regarding the same, so we can modify the treatment course accordingly.